Burnout Among Nurses by Isamarie Marquez. Hi everyone, I just want to say thank you for having me here today. It is a pleasure to be sharing this project with all of you, so let's get started. First off, my name is Isamarie Marquez. I am currently enrolled at Regis College in the Pediatric Nurse Practitioner program, seeking a master's degree in this wonderful field. I currently work as a surgical nurse in the Women's and Children's Operating Room at a hospital in Tampa, Florida. I absolutely enjoy my job, but it certainly comes with a lot of challenges that I will address shortly. I went straight into the OR right out of nursing school. Not many get the chance to do that, but the opportunity presented itself, and somehow I ended up working in surgery. I am very versatile in my skills in the operating room as I can maneuver through the many surgical specialties that exist. I have experience in general surgery, adult and pediatrics, GYN, urology, plastics, ENT, and quite recently, pediatric orthopedics. So, the title for this proposal is called Burnout Among Nurses. You may be wondering why burnout and how does it apply to nursing? Well, burnout is something we have all probably heard of as it is a true phenomenon that occurs. According to Dalora et al. 2020, burnout is considered to be a phenomenon experienced by nurses who have lost motivation, compassion, and commitment in their nursing career and patient care. This phenomenon occurs often in nursing and is often mentioned in research articles. There's research on burnout among floor nursing and other nurse specialties, but there's not much information on burnout experienced by surgical nurses. And let me tell you, we do experience burnout. That is why I want to focus this proposal on this population group. I have personally experienced burnout, especially in the last few months, since we have lost so much staff in my department for just due to a number of reasons. My department is a small department and we have to pick up call shifts because surgery, of course, is open 24/7 in a hospital setting. So the amount of call shifts we have to pick up is extensive and we get called in a lot of the time. So often working late into the night and into the morning hours, as well as being required to work the next day and at times stay late. This has caused burnout among the nurses in my department as we are all feeling exhausted and emotionally and physically drained from excessive work and chronic stress. This is the background. Okay, so to gather more information on burnout among nurses in relation to surgical nurses, a literature review was performed. So for the literature review, I decided to focus on leadership styles, emotional intelligence, and support and interventions. These concepts were used to focus on how manager leadership styles and emotional intelligence impacted burnout among nurses. So support interventions were also evaluated to find ways to reduce burnout among staffs. So research showed that having a support system helped to reduce burnout among staff. So having a social support, especially in the workplace, is significant to reducing levels of burnout within the nursing staff. This is done by a study done by Villando Soriano et al. In 2020. So also leadership styles among managers affected how staff felt and if they were willing to stay in their departments versus leaving. So one major gap in the literature was the lack of research among surgical nurses working in the operating room and how the effects of call shifts affected department morale and burnout in general among OR nurses. So the purpose of this proposal is to gain a better perspective on nurse burnout and employee retention in facilities. The goal is to find ways to provide emotional and social support from supervisors and managers and formulate a plan to educate leaders on the importance of practicing emotional intelligence with their staff. The aim of the project is to measure staff satisfaction in relation to burnout rates and how positive leadership styles and emotional intelligence can impact these rates. So, burnout also impacts work culture and the work environment. Having a positive work culture can influence how nurses work with each other and the rest of the surgical team. So, for this project, the research method used is the survey research method. So, I thought this would be the best method to gather qualitative data from surgical nurses as the research design is a qualitative research design. So the sampling method that will be used is the purposive sampling method, as this seems the most appropriate method when the population of interest is known and is purposely selected for data collection and research purposes. So for this project, a survey will be sent to nurses working in the surgical specialty and who have experience working in a hospital operating room. Inclusion criteria for participation will include nurses who work in the operating room and who have at least 1 to 2 years of surgical experience. These nurses must also be a part of the call shift rotation at their hospital. The sample size will consist of at least 20 nurses who are eligible to participate. And with all research, there's always a need for ethical consideration for research participants. So for this project, an enrollment request proposal will be sent to the Regis College Institutional Review Board to be reviewed prior to enrolling study participants. Also, once there has been approval from Regis College, another application will be sent to the Institutional Review Board at Avid Health Tampa, where this survey project will take place. Once there has been approval from both entities, an informed consent will then be signed by the participants. The participants will participate in the survey asking various questions about burnout, overwork, and work-life balance, as well as supervise the response to work challenges. The responses to these surveys will be locked away in a safe file on my computer. My research partners and I will be the only ones to have access to these records, and the participants' information will be kept confidential and will not be released to others. So why is the prevention of burnout significant to the field of nursing? Well, with the national worldwide nursing shortage problem, reducing burnout is significant in retaining staff in facilities. When there is a significant number of staff, stress levels can be reduced and cooperation among staff members can be increased, therefore increasing job satisfaction. Patient care can also be affected by burnout, and it is imperative that patient safety is a priority, as the presence of burnout leads to a decline in patient safety, according to Garcia et al. 2019. So we have innovation and ideas. So to combat the burnout problem, increase job satisfaction, and increase staff retention in facilities, there are ideas that can be proposed. These include team building opportunities or programs. Team building programs can be beneficial in the surgical department as everyone can become aware of the problems other team members face daily and gain more respect for each other. In this way, everyone can come together and find shared solutions to shared problems. Team building strategies and training are extremely important in the operating room, as surgery teams constantly work together to provide the best and safest care to patients. This is a reference by La Carenza et al. 2018. So, also having social support is a huge contributor to reducing burnout, as it provides assistance emotionally and is effective in reducing stress that nurses may face, leading to a lower rate of nurse burnout. Support can be provided through coworkers, nurse leaders, and psychosocial services that hospitals may provide. Social support can also be considered within the perioperative environment for surgical services, as having a group of coworkers and leaders who nurses can rely on in the workplace can greatly reduce the stress levels operating room nurses feel, especially for those who are new to this stressful environment. This would have been really helpful for me when I was straight out of nursing school and into a really crazy, stressful environment. So why should this proposal be funded? Well, first off, it is significant to nursing. Surgical nurses need support and the impact it will have for future nurses. If not addressed, nurse burnout will always be a problem in the nursing field. As the older generation of nurses retire and the new generation rise up to take their place, increased workload stress, new technologies, and social issues will impact the way these nurses interact with patients and with each other. In the operating room, things are always changing constantly, adding to existing problems that, if not resolved, will keep building until they reach maximum pressure. In the case of nurse burnout, maximum pressure will present as a large number of nurses quitting, leading to a shortage that greatly impacts patient care in the community. To prevent this from happening, surgical nurses need support from leadership and each other, letting their problems be known and reaching out to others for help. This is why this proposal should be funded. In order to help future nurses who will fill in the gap in the years to come, let us not let them become a part of the burnout phenomenon. These are the references that I use for this. And thank you for having me here today. It has been a pleasure, and I look forward to hearing from you soon.